professional health program ever here in Ghana, and you are watching your oral health with HASHEM Dental. My name is Tiana. You can also call me Miz Tiana. Today I have with me here the practitioner in charge at HASHEM Dental. She is also the managing director right here in HASHEM Dental, and she's here to help me with my discussion for today on the topic your oral hygiene practices. So don't go anywhere, we will be right back. You are watching your oral health with HASHEM Dental, and my name is Tiana. You can also call me Miz Tiana. If you are watching us on Facebook, it's HASHEM Dental at Akosomo. Don't forget to also subscribe to our YouTube channel, it's Miz Tiana TV Shows. And today I have with me here the practitioner in charge of HASHEM Dental. She's no other person than Mrs. Lola Kpodo Tamakloe. She's the one to help me with today's discussion on the topic, your oral hygiene practices. So let's get down to business. Mrs. Kpodo, welcome to your oral health with HASHEM Dental.
Thank you very much. It's a pleasure.
You're welcome. So last week we discussed on the topic oral health, and we told our audience that we are going to also talk on the topic oral hygiene practices. So I would like to know what is oral hygiene.
Okay, oral hygiene simply is keeping the mouth clean or the oral cavity clean and then free from diseases.
Okay, so that is the basic definition.
Yes.
Of oral hygiene. So what does oral hygiene involve? What does it involve?
Okay, oral hygiene involves cleaning of the teeth, keeping the gums healthy, keeping the tongue healthy and clean.
Okay.
So it entails toothbrushing and then brushing of the teeth, not only using the toothbrush, but there are some portions of the teeth that cannot be cleaned with the brush. So cleaning those sides with floss.
Okay.
Yes.
Oh, really?
Yes. So it's cleaning the teeth, and then with the gum, with cleaning of the gum, you can't do it all by yourself. Flossing helps, but you also visiting the dentist or the dental facility for professional cleaning. Yes. Those are the things that entails oral.
Okay, so what is the importance of observing oral hygiene?
Okay. It prevents diseases in the mouth, and then it keeps the mouth healthy, and then it makes you confident. Yes.
Okay. So let's talk about brushing of the teeth. How is there a special way for us to brush our teeth, or it's just like everybody wakes up and do brush our teeth? Is there a special way as a dentist? Is there a special way for us to brush our teeth?
Yes. So you can see here I have some model here.
Okay.
It's a giant tooth and a giant toothbrush. So before you talk about toothbrush, first of all you have to know the right toothpaste to use, the right toothbrush, and the right movement you have to do during brushing. How many times you have to brush? So you have to brush twice a day, in the morning and in the night before you go to bed. So there's a saying that you brush your teeth in the morning to keep your friends, and then you brush your teeth in the night to keep your teeth, to keep your friends, because in the morning during the day you smell, your mouth will smell good, your teeth will appear nice, but in the night it prevents diseases like dental caries. So daytime you keep your teeth clean or you brush your teeth to keep your friends, your family, people around you. Then the night to keep your teeth. Okay. So first of all, the toothpaste. I hear this question a lot. People keep asking me which type of toothpaste do I recommend?
Yeah.
Well, I always tell them that I'm not going to advertise for any company. All I can say is that your toothpaste toothpaste should contain fluoride.
Okay.
Yes.
So what is the purpose of the fluoride in the toothpaste?
Okay, so what fluoride does is that it helps in remineralization of the tooth.
Okay.
And then it makes the tooth enamel stronger and also prevents dental caries or cavities.
Okay, so what's the tooth enamel? Which part of the tooth is located?
Alright, so let me show you this diagram. You see that every tooth has 3 layers. Okay, it's not only one layer.
Okay.
So we have the outermost one, which is the enamel, the white thing you see in your mouth.
Okay.
And then we have the dentine, that's the second one. And then we have the innermost part, that is the pole. So what I'm talking about is the outermost part, the white thing you see in your mouth. Yes, that is the enamel. That's the surface.
The white thing you see in the mouth.
The white, yes. You see your tooth in your mouth. When you pick a tooth, the white covering on the tooth is called the enamel.
Enamel.
Yes.
Oh, okay.
Yes.
Okay, so how will you know if a toothpaste contains the fluoride?
Okay, you will know by, usually the information is on the package.
Okay.
Either on the toothpaste package or on the box that it comes in. It's written on it that it's fluoride.
Okay.
And those that don't know have fluoride too, it's stated on it that no fluoride.
Oh, okay. Okay, those that doesn't have. Okay.
So you choose those with fluoride.
Okay. So let's talk about brushing the tooth, what it is. We were talking about using the right toothbrush to brush the teeth. So how are you going to know whether this is the right toothbrush?
Okay, so when you look at the toothbrush I'm holding, you see there's some hairs here.
Yeah.
They are called bristles.
Okay.
So we have different types of bristles. We have soft, medium, strong, hard and extra hard bristles.
Okay.
So usually the soft, it's for people with sensitive teeth, extremely sensitive teeth, and then for children.
Okay.
But with the medium, it's for any normal person, any other person, any adult, or you can use it. Yes. So that's it. So the appropriate one you should choose is a medium bristle brush. That is if you don't have sensitivity, you're not a child. But if you have extreme sensitivity or for a child, you're supposed to use soft bristle brush.
So does that mean that using hard toothbrush is not the right one?
Yes. What hard toothbrush does is that
Okay.
it damages the enamel.
Oh,
The
really?
enamel, yes. You see, the enamel is the outer covering of the tooth. So it's like a shield or a protection for the rest of the tooth, the rest of the sensitive portions of the tooth.
Okay.
Okay, so what hard toothbrush does is that it wears it off. Okay, it damages it. So it erodes it or wears it off. So the portions of the tooth that are sensitive to your oral environment, they are sensitive to it. So God in His wisdom have covered it up.
Okay.
You expose it. So you now start, your tooth starts reacting to the environment, the oral environment.
Okay. So, but people believe that when you use the toothbrush, your hard toothbrush, it helps to clear some stains from the tooth. What about that?
Well, you try. It's not about the type of toothbrush. You could use a hard bristle brush, but if you don't do the appropriate movements on your teeth during brushing, you still have those things there.
Yes, it's true.
Yes. And then the hard bristle toothbrushes, they don't clean, they don't wipe away the stain as it is said. It rather damages, even though it may remove the stain, it will end up damaging the enamel too. So you should weigh which one is more advantageous, to damage your enamel
Or using the correct toothbrush. Okay, so how are you supposed to brush your teeth? Brush your teeth.
So thank you. Like I said, after choosing the appropriate toothpaste and then the appropriate toothbrush, what you do is that first of all you take your toothbrush and you load your toothbrush with your toothpaste.
Okay.
Then you can make it wet a bit.
Okay.
Because usually our toothbrushes are dry. So what you do is that you try to draw small circles. You see, we have different surfaces of the teeth. Okay. You see, we have the surfaces which are called the facial surfaces of the teeth. Okay. And then we have the inner parts, which is called the lingual surfaces.
Okay.
And then top two, we have the palatal surfaces. Okay. So, and then we have the occlusal, that's the molars usually, and the premolars, they have some flat portions. Okay. So, cleaning them is different, and all of the surfaces demand a different type of cleaning.
Wow.
So, you see some people brushing this way, only this way. You see some brushing this way, like up and down here. You see people doing this way with a lot of pressure. It's not appropriate. Okay. So there's a method. This is good, but it has its own side effects. This is also good. It has its own side effects. The side effect that it cuts the cervical regions of the teeth, that's the neck of the teeth. When you do this, you put a lot of pressure on it.
Okay.
And then when you go this way, it pushes away the gum. So you're pushing away the gum from the cervical regions of the tooth. So a method has been introduced, which is like a circular method. So it's a combination of the straight one and the sawing method. So you do it this way. So what you do is that when after loading the toothbrush with the toothpaste, you maybe put it in dip it in the water to make it wet. Then you draw small circles on each tooth. You make sure you brush each tooth. Not only so you take your time and then try to draw small circles. You brush it in a circular motion. Okay. Around each tooth. So you take your time and you should spend 2 minutes brushing your teeth, the full set of your teeth and cleaning your teeth. You spend 2 minutes. You spend 5 seconds until you are done. So we encourage effective toothbrushing, not just brushing. So, like I said, you draw small circles around the facial surfaces of the teeth. This side. Okay. Then the lingual, that's the inner part where there is where the tongue is. The part that's facing the tongue and the part that's facing the palate here. You try to brush it outward from down up this way. Okay. Brush it this way.
Wow.
So you do it this way. The upper ones, those that are facing the palate, that one you brush it in that order. Okay. Then on the molars and the premolars, those surfaces are flat. So you can use the sawing method, the one we know already. You can use it for those surfaces. Okay. So the upper and the lower. And you use that sawing method. But don't put too much pressure on it. Because the more you put pressure, the more you damage the enamel. So you don't put too much pressure on it.
So those guys that be brushing it like this, it's like the men, please. You're not fighting with your teeth.
Like some people brush their teeth like they're scrubbing the bathroom. You can hear it. That is not appropriate. You are damaging your enamel if you brush that way. Then the last thing you should brush is your tongue. Because it's very dirty. Everything passes on the tongue. And you know the tongue is not really smooth. It has some hairy structure on it. That harbors a lot of saliva, food particles, and bacteria. So make sure you brush it out very, very, very well. So when you're done,
Like this.
yes,
That's not what
you brush it outward.
Oh,
And then you can also use the scraper
okay.
to clean it very well. So that's about the toothbrushing. And then, like I said, the toothbrushing does not clean all portions of the tooth. You know, there are some hidden portions like where there's contact in between the teeth and all that. The brush cannot get it. They are very tight. So those are the places we use the floss to clean. This is a floss case. And this is a smooth floss. different one, this type.
Okay, so you can either use this one or
Yes, they are all yes, you can use this one.
But which one is more effective?
Well, here some people have for a long time mastered using the spoon first.
This one.
So you can use it. But some people are not comfortable with this, so they prefer this kind. So what you do is that you glide it in between the spaces. You glide it into the spaces.
Is it after eating or during toothbrushing?
You can do it after eating to remove food particles.
Okay.
But for oral hygiene practices, at least once a day, especially in the night, okay, you take your time and you clean in between each teeth. Okay, in between all the teeth before you brush your teeth. Some people say you should do it after, but I prefer you doing it because usually when you floss, you cook and you smell it. It smells really bad. So that there's bacteria there and then there are food particles there. So after taking it out, I prefer that I do it so that the odor will not be there. That's one. And secondly, so that the fluoride in your toothpaste also get into the contact. Yes. So that is what you do, especially in the night. And then one thing I should tell you about toothbrushing is that it should be the last thing you do before going to bed. Don't go and brush your teeth and then you go and eat again. If you eat again, you brush again.
Wow.
Because if there are food particles, we'll be treating, first we'll be treating the dental caries. We'll see how it comes out, like how it comes about.
Is there an next
Yes, dental caries, how it comes about. Then you understand why you should. A brushing of your teeth should be the last thing you do before going to bed. And after brushing, you don't eat anything again. It's very dangerous. So in our next episode, we're going to talk about that.
the dental caries?
Yes.
Okay. So my last question is, how do we keep our toothbrush? Okay. Is it safe to be exposed?
No, it's not safe to be exposed. Something that you put on your mouth, it is not safe to be exposed. Okay, so these days I've seen some toothbrushes with covers and then some toothbrush holders, even some have sterilizers on it that you hang on the wall and then you hang the toothbrushes in it.
Oh, okay.
So yeah, to prevent the bacteria and then microbes generally from infecting the toothbrush which you use again. So you can find and you can improvise ways and means. Maybe find a container, you put them in it. Okay. Because if you leave it lying down just like that, anything could pass away. The wall geckos, the cockroaches, housefly. So you just keep it safe. If you are not able to protect it, so maybe when you pick it and you're about to use it, you can wash it or put in some hot water before. Yes, it won't kill everything totally, but it will reduce the rate. Yes.
Okay. Last but one. What causes gum bleeding?
Okay.
When you brush your teeth?
Okay. It's an inflammation of the gum, an infection in the gum that causes gum bleeding.
Infection.
Yes. That one too is a condition that we will treat. We call it periodontal disease. Okay, so we'll be treating that one too.
Okay.
Yes.
Okay, so then my final question. Sorry. Apart from, observing all these things in your homes, oral hygiene in your homes, what are the other ways also?
Okay, so another most important way is to visit your dentist or a dental practice.
Okay.
Twice a year, that's every 6 months, for your teeth to be checked and then for you to get a professional cleaning. It's good we do the toothbrushing, effective toothbrushing, do effective flossing. But that doesn't end it. There are still some things in the mouth that there's some portions that you can never reach, even with the toothpaste, the toothbrush, and the floss. So you have to get to the dental clinic so you have your professional teeth cleaning done for you, or what we call SMP, or scaling and polishing of the teeth done for you. See, when I don't know whether you've seen this kind of lining under people's teeth.
Yes.
Yes. So these things build up gradually.
Can you show it to the camera?
Yes. You see the yellow linings under the teeth. You should observe in the mirror. You could see it in your own mouth, or you see it in somebody else's mouth. So these things, they cannot be removed with even effective toothbrushing or flossing. So when it comes to the dental clinic, or you go for your dental visit, a machine called an ultrasonic scaler is used to remove them and then clean them off the tooth, and then we polish the surfaces of the tooth to prevent them from forming quickly, and then to make the gum and the teeth healthy. So you have to visit the dentist twice, and if not twice, at least once in a year, to have this done to make your gums and teeth healthy.
Okay, so you were talking about visiting the dentist, but you know there is this kind of perception that visiting the dentist is very, very expensive. So what do you have to tell the audience?
Okay, so what I have to tell audience is that dental care is not expensive. Okay, it's negligence that's expensive. Dental conditions are such that when they start, each treatment is less invasive and it's also less expensive. It's not expensive. So it is the time that you report at the dental clinic that makes your treatment expensive. If you walk into a dental clinic and then we examine you, we do some cleaning for you, examine and see there are cavities forming in your mouth, we'll feel it. Filling is not much expensive.
Okay.
So it will save your tooth, it will also save you money. But when you come in advanced stage of dental caries that you have a big hole in your tooth, you are in so much pain, we'll have to take the tooth out. Taking the tooth out is expensive. That is one. And also replacing the tooth is very expensive. So it is because you wait until you are in so much pain, you neglect the small signs that the tooth gives you, and you wait until you are in so much pain before you walk into the dental facility to get treatment. That is why it seems expensive. So to avoid spending too much on your dental care, it is appropriate that you do routine dental checks. You walk in so that we'll see what we can do for you at an early stage, so that you don't waste so much money.
Okay. Thank you so much, Doctor, for coming. We hope to see you same time next week. So viewers, that was a very educating information from our practitioner in charge, Mrs. Lola Kpodo Tamakloe. We hope to see her same time next week. Next week, we are going to talk on the topic dental caries, which is popularly known as caca. And I can't wait to share this moment with you. Same time next week. Don't forget, this is your oral health with HASHEM Dental. Thank you. Bye.